Welcome to the Hip and Knee teaching class. My name is Kayla and I'm a therapy assistant at the South Health Campus Orthopedic Unit. Today I will be going over what to expect before, during, and after surgery, equipment, exercises, and walking aids. The first thing is to encourage you to continue to do the phase 1 exercises. If you are having your hip replaced, please refer to pages 13 to 17 in your booklet. If you're having your knee replaced, please refer to pages 13 to 16. If you have not started those exercises, please start those exercises today. Those exercises get the joint and muscles ready for surgery, which will help you in the recovery process. The next thing you should consider is preparing your home. Because you will be walking with a walking aid, you will want to get rid of clutter like throw rugs. You may also want to consider preparing some meals beforehand. This may make things a little easier for you after surgery. Our goal is for you to be as independent as possible when you leave the hospital, but you still may need some help. This is why it is important to have a support person in place that you can call. Movement precautions are specific to each surgeon. If you require clarification regarding movement precautions, please contact your case manager or surgeon. Precautions are put in place for your comfort unless you are told otherwise by your surgeon. The knee precautions include no forced knee flexion, no twisting, and no crossing your legs. The hip precautions include no bending past 90 degrees, no twisting, and no crossing your legs. Unless you are told otherwise by your surgeon, these precautions are put in place for your comfort. Now I will run through some equipment you may require. All equipment have a height and weight restriction, so please pay attention to that when buying, renting, or borrowing. Not everyone will need every single piece of equipment, but everyone will need a walking aid. Please ensure that you have all equipment in place in your home prior to surgery. It is also helpful to install each piece of equipment and try it out before surgery. The first item we will talk about is a raised toilet seat. The first style is a basic raised toilet seat and it comes in 2, 4, and 6 inches. You will want the toilet seat to be at about 4 inches from the back of your knee. The height of the toilet seat would depend on how tall you are and how high your toilet is at home. I would use a basic raised toilet seat if you had a vanity or something to push up from next to your toilet. If you do not have anything to push up from next to your toilet, you may want to consider a toilet safety frame in addition to the basic raised toilet seat, or a raised toilet seat with attached arms. But this is only available in 5 inches, and it requires a lot of space around your toilet. Raised toilet seat with armrests are suggested to make things a little easier to get on and off the toilet while you are recovering from surgery, as well as it is to assist with maintaining movement precautions if applicable. Next, I will talk about equipment to assist with showering. If you have a walk-in shower, you can use either a bath stool or a bath chair. There is no benefit from choosing the stool over the chair. It is just based on your preferences. Some people prefer to have a backrest on the chair for additional support. If you have a tub shower combo in your bathroom, you have 2 options. The first option is using a bath stool or a bath chair seated to the back of the bathtub with a grab bar attached to the side of your tub. You would use this option if you had little room around your tub. The other option is the bath transfer bench. This option allows the bench to sit inside as well as outside the tub. This option will not work in your bathroom if you have glass sliding doors or if you have a sink or vanity, or maybe even a toilet at the end of the tub. Getting dressed may be more difficult after surgery, especially if you're having a hip replacement. So these 3 tools can help make it a little easier. First, there's a long-handled reacher. The long-handled reacher allows you to put on your pants without bending forward. By grabbing the pants by the waistband with the reacher, starting with your operated side first. The second is a sock aid. The sock aid allows you to put on your socks without having to bend or cross. The last item you see is the long-handled shoehorn. You will need to use a walking aid after surgery, a 2-wheeled walker, or crutches. A walker and crutches allow you to offload weight from your surgical leg while walking. A 4-wheeled walker does not work after hip or knee replacement because it does not allow you to offload weight on your new joint. First, you need to make sure the 2-wheeled walker is the correct height. By standing up tall and relaxed inside the walker with your arms to the outside. The walker handles need to match the crease of your wrist. The correct sequence when walking with the 2-wheeled walker is to push the walker forward first, followed by your surgical leg, stepping through with the good leg. The next item are the crutches. The crutches, believe it or not, are exactly the same as the 2-wheeled walker. The first thing you need to do is to make sure the crutches are the correct height for you. By putting the crutches under your arm and about 6 inches from each foot, there should be about 3 to 4 fingers from your armpit to the top of the crutch. You do not want any weight going through your armpits. All the weight goes through your hands. Once the height is adjusted, drop your hands to the outside of the crutch, measuring the handles to the crease of your wrists. The sequence when walking with the crutches is to put both crutches forward first, followed by your surgical leg, then stepping through with your good leg. If you will be using the forearm crutches are measured by the crease of your wrist. Next, we will go over the stairs. If you have 2 steps on the outside of your home or 14 on the inside of the home, you will need to practice the stairs using the crutches. If you have a nice secure railing, you will use that railing with the crutch in the opposite side. If there is no railing, you will use 2 crutches. When you go up the stairs, you go up with the good leg first. And you go up with the good leg first because the good leg is doing all the hard work and lifting your body up the stairs, followed by your surgical leg and the crutch. Coming down the stairs is the exact opposite. The crutch goes down first, followed by your surgical leg, and then your good leg. Again, the good leg is doing all the hard work and lowering your body down the stairs. Please refer to your hip and knee booklet for further description if required. Not everyone is going to need every single piece of equipment, but you will need a walking aid. And of course, the crutches if you have stairs. The easiest and most convenient way of getting equipment is to buy or rent. You can buy or rent from any medical vendor. The other option we have is the Red Cross Loan Program. The Red Cross Loan Program allows you to borrow equipment. You will need a referral from a healthcare provider to utilize the Red Cross Loan Program. However, Red Cross is highly utilized, so there is no guarantee that all of the equipment you require will be available. We encourage you to think of other ways to obtain the equipment in case Red Cross does not have what you need. What should you bring to the hospital? Well, we have 2-wheeled walkers for everyone on our unit, but we do not have enough crutches or dressing aids. Please bring in your own crutches and dressing aids with you on the day of surgery. We want you to get dressed as soon as possible for your own comfort. For clothing, something loose-fitting and comfortable, And for footwear, something with a hard sole and a back. Nothing that will be flip-flopping off your feet while we're reteaching you how to walk. Depending on the plan with your surgeon, you may be having a day surgery or you may be admitted overnight. If you are having day surgery, you will see your physiotherapist within 4 hours after surgery. If you are being admitted overnight, you will not see your physiotherapist until the next day. Everyone is expected to get moving as quickly as possible after their surgery. The nurse will help you to sit, stand, possibly walk with the two-wheeled walker anywhere from 1 hour after surgery to later in the evening. If you are admitted, you are first seen in the morning by the physiotherapist. Each time you see a physiotherapist, you can expect to work on phase 1 exercises, bed mobility, walking with the two-wheeled walker, walking with your crutches, and practicing the stairs. You will be discharged from physio when you are able to independently complete your phase 1 exercises, getting in and out of bed, walking with your walking aid, and safely going up and down the stairs. For day surgery procedures, the goal is to have this completed on the day of surgery. For patients that are admitted, the goal is to be discharged the day after surgery. There is no driving for 6 weeks after surgery, so you will need to arrange for rides for errands, visits, appointments. Once you're at home, you will continue the phase 1 exercises 3 times a day, morning, afternoon, and night. You will get up and you will move around with your walking aid. With all the exercising we want you to do, we also want you to rest, ice, and elevate. To help with swelling, we want you to elevate your legs every few hours for about 20 minutes at a time. When you're elevating your leg, make sure your ankle is above your heart and your knee is straight. With your leg elevated, pop some ice on your joint. Every single waking hour, we want you to pump and rotate your ankles. A physiotherapist from the Bone and Joint Clinic will see you when you attend clinic to see your surgeon or case manager at 2, 6, and 12 weeks after surgery. If you have a phone or virtual follow-up with your surgeon or case manager, a physiotherapist will follow up via phone. You may see a physiotherapist in the community when you are directed by your surgeon, case manager, or physiotherapist. With this surgery, you are eligible for 7 physio visits that are funded by Alberta Healthcare. In order to qualify for the funded visits, you must attend your first appointment prior to 12 weeks after your surgery date. There are a list of physio clinics that offer the funded visits in your hip or knee booklet. Now, that being said, not everyone will require further physio if you're doing your exercises 3 times a day and you're up moving around. If you have any questions, please refer to the information package you received in the mail, or if you require a Red Cross referral. Thank you.